Madam President, I rise today in support of the amendment Senator Hirono and I are offering to protect Medicare and Medicaid for the millions of Americans who currently count on these programs for health coverage. This week, some of our colleagues are beginning the process of repealing the health care law. I want to be clear, I don't think it's a perfect law. In fact, I've long agreed with many of my colleagues in saying it has work to do. And for years, we've put forward ideas on ways we can work together to improve it. The repeal strategy we're debating this week, however, is not about improving the health care system. It's about taking people's health care away. And make no mistake, the consequences are very real. A repeal strategy, particularly with no alternative, would throw our health care system into chaos, taking away coverage from nearly 30 million people, increasing premiums on working Hoosiers and families across this country, and threatening to take us back to a time where anyone with a pre-existing condition could not get coverage. It doesn't have to be this way. If we're serious about improving health care in this country, we can do this work together. That's what the American people expect. Just as Hoosiers go to work every day to make life better for their families, they expect us to come to work and do the same thing. And at the very least, they expect us to do no harm. Doctors swear by the Hippocratic Oath, where they pledge to first and foremost do no harm when they are treating patients. We should approach this debate in the same manner. Do no harm. That's the basis of the Hirono-Donnelly amendment. Do no harm means not cutting Medicare benefits or turning it into a voucher program. Do no harm means protecting the health care of those who use the Medicaid program, many of whom have health care for the first time. Here's what we know. Repealing the health care law reduces Medicare's insolvency by 5 years to 2021. We know that some in Congress, including the nominee to run the Department of Health and Human Services, are intent on privatizing Medicare or turning it into a voucher program, ending the program as we know it. The Hirono-Donnelly amendment makes it clear we will not privatize Medicare. The amendment protects Medicare both for the seniors who count on the program to age in dignity and for the tens of millions of Americans who are contributing to the program with the expectation it will be there when they retire. Do no harm also means we will protect insurance coverage for those who get their care through the Medicaid program, which after the passage of the health care law enable millions of our friends and our neighbors to access affordable coverage for the first time in their lives. I know this is true because I worked with and supported our soon-to-be Vice President, Mike Pence, when he used Obamacare to establish a program we call the Healthy Indiana Plan, or HIP 2.0. The innovative plan expanded health care coverage to over 200,000 of my neighbors in our beloved state and helped reduce the uninsured rate among Hoosiers by 30%. 30%. The HIP 2.0 program has been critical in our ongoing effort to provide treatment to those struggling with opioid abuse and heroin use in our state. Don't just take my word for it. In his farewell address as governor to Hoosiers yesterday, Mr. Pence said, and I quote, "Our innovative Healthy Indiana Plan is a national model of how to provide affordable health care coverage to our most vulnerable citizens. With HIP 2.0, we have also made great strides expanding treatment for those who struggle in the grip of drug addiction." I agree with the Vice President-elect that HIP 2.0 is something we can be very proud of because it helps Hoosier families across our state every single day. And it was done by working together. Republicans and Democrats using the health care law to provide access to our friends and neighbors who wouldn't be able to obtain insurance otherwise. That's a great result. The repeal plan before us today takes all of this away, including the very program that Vice President-elect Pence and I worked to put in place. The amendment Senator Hirono and I put forth is simple. It says to seniors and to people participating in HIP 2.0 and Medicaid plans across the country, we will do no harm. I'm happy to work with anyone to strengthen the health care law, but we're not going to take away the health care that people have come to rely on. I urge my colleagues to support the Hirono-Donnelly amendment. Instead of going forward with a plan that creates chaos by repealing the health care law with no alternative, we should work together to improve it. That's just common sense. Most of all, we should strive to do no harm. That should be our guiding principle here in the Senate. And my colleagues on both sides of the aisle can demonstrate their commitment to this principle by supporting our amendment. Madam President, I yield back.